Can medical cannabis help with autism symptoms? The research is growing, but it's really not that simple. Hi, my name is Dr. Marion McNabb, and this is the Cannabis Citizen Science channel, breaking down the research so you can make informed decisions about your health and wellness. So, autism spectrum disorder, ASD, is a neurodevelopmental condition that can involve challenges in communication, behavior, anxiety, and sensory processing. Right now, there are limited medication options to address these symptoms, especially irritability, anxiety, and sleep. So, why medical cannabis? Why is there a deep interest in the clinical value that medical cannabis can bring? Well, it comes down to our endocannabinoid system, which is a vital system in our body and plays a role in brain development, mood, stress, and social behavior. This has led scientists to explore cannabinoids, especially CBD or cannabidiol, as a potential therapeutic option. So, what does the research really say? Some clinical and observational studies suggest that CBD-rich cannabis products may reduce symptoms like anxiety, depression, and sleep disturbances in individuals with ASD. A recent randomized placebo-controlled trial found improvements in disruptive behaviors with cannabinoid therapy in children and adolescents. However, this is promising, but more studies are needed, and most are still small and observational studies. But let's dig into the cannabinoids here. CBD or cannabidiol is the most studied cannabinoid in ASD because it's non-intoxicating and may help regulate mood and stress. THC is oftentimes included in small amounts for the entourage effect, but higher doses may increase anxiety and behavioral effects in some individuals. Now, it's important to note that cannabis is not a cure for autism, and responses can vary widely because cannabis is a personalized medicine. There's important considerations around dosing, product quality, age, and brain development, and it's always critical to work with a healthcare provider experienced in this area. So the bottom line, it's promising to have medical cannabis play a role in ASD, but it's still evolving science. Follow me for more cannabis research where we dig into the cannabis science one study at a time.